I'm Dr. Phani Madhuri. I'm a senior consultant obstetrics, gynecology, fertility medicine and laparoscopic surgery at Kiran Infertility Centre, Koramangala, Apollo Cradle Hospital, Jayanaka, Bengaluru. So vaginismus is a condition which is seen in almost 5 to 15% of women, not overtly discussed or not openly talked about within their friends and family because of again the social stigma of the problem. But we see a lot of these women in our OPD practice where women come with this problem of not able to have penetrative intercourse. Now this is a condition where women go into spasmodic contractions, involuntary contractions of the pelvic floor muscles where they tighten themselves very much, which doesn't allow the partner to have penetrative intercourse or unable to insert any kind of objects into the vagina. For example, even when we are examining a speculum or a tampon, etc. Now, it may be mostly psychological most often, but rarely sometimes there can be physical conditions which are causing severe vaginal pain like infections, chronic endometriosis, chronic endometritis or any other painful nerve endings in the vagina or in the vulval region, right? So these women have this extreme pain, the fear, and they get into a very tight mode or a contraction mode because of which they are unable to have a penetrative intercourse. Now, many of them have a history of probably childhood sexual abuse, or they have had a very conservative social, moral upbringing where they have had negative emotions towards the sex, and that is why they are not able to accept it, or maybe some kind of a fear that they have encountered in the past, or it can happen after a severe scarring because of a deep episiotomy. So any of these conditions can trigger that kind of a pain, fear in these women, and they can have this condition called vaginismus. Whether vaginismus is psychological or physical problem is always a question for the patients. What we see normally is most of these women are physically normal. They have a normal vagina, they have a normal uterus, cervix, and they don't usually have any major illnesses within the pelvis. But so we obviously think that it is mostly psychological because of this extreme fear. See, there are so many people prone for different kind of fears. Some people have fears of height, some people have fears of fire, some people have fear of water. Just like that, there are some people who have fear of something entering their body or having a penetrative intercourse, and they involuntarily go into the fear mode, and because of which the body tightens further. So once the muscles tighten further, the intercourse will obviously become painful, or it may not be as easy and smooth as when they are cooperative. It has both the components. Very rarely for some patients with this kind of a problem, we see a fibrotic ring or a very tight hymen, or probably some spots which are very sensitive and very pain eliciting regions in the vagina. So in these patients, we do a procedure called Fenton's procedure, or we release the tight fibrosed rings through a surgical help and widen the passage with the help of a procedure, and which will further improve the sexual function in these patients. But the options for surgical treatments for these conditions are quite rare. Coming to non-surgical treatments, what work for vaginismus, I think one is open communication. I think you have to be very comfortable and confident about your partner and support your partner through the whole process of intercourse. Because if you are not allowing your partner with that kind of confidence, then the partner will also start having psychosexual problems. We have seen this passing on to the other partner also because of the primary partner. So I think first thing is have an open discussion, have a communication, and have confidence in your partner. The second thing is you can probably try slow methods like slow vaginal dilatation with graded dilators. You have options of different kind of vaginal dilators today, wherein you can insert these dilators one after the other size wise and enlarge the passage. You do it yourself first and then allow your partner to do it for you, which will give you the confidence again. You can also use a lot of lubricant jellies. You can also use local anesthetic jellies, which will further enhance your penetration. And also you can think of pelvic floor exercises like Kegels exercises, neuromodulatory physiotherapeutic pelvic floor exercises. And you can also think of deep diaphragmatic breathing that will automatically relax your pelvic muscles and help you in penetrative intercourse. The support of your partner throughout this entire process is very, very, very important, and I think it's the single most important factor which will help you overcome this condition. So I think foremost is communicate openly with your partner. Try to explain him what you're going through. If he's unable to understand and if you need further help, please seek your gynecologist. Come over as a couple, have a consultation together, and when we can explain you what exactly both of you have to do during the process of intercourse to help you have a enjoyable experience without that fear and trauma of the penetrative intercourse. So I think having an open communication, seek out for help, think of using a relaxed environment for your intercourse. Don't be under a very stressful environment. Give sufficient time to foreplay. Use help like aids like vaginal dilators, lubricant jellies, anesthetic jellies. All these things are extremely helpful, and listening to some soft soothing music. Keep your mind relaxed. Don't have any kind of other anxiety issues because of your daily work stress or other things. Keeping all these things at bay and being in a very relaxed environment with an open communication with your partner is of key importance to overcome this problem called vaginismus.